Vaishnavi, you can have a look at the mobile. So whether the YouTube is showing us live.
Yes, sir. Just a
So
minute.
yeah, I'll be pulling you in after a minute only, so you can check on that. Yes, we are live now, sir. So shall we start off the proceedings, sir?
Yeah, please.
Yeah, please go.
Yeah. So good afternoon and good evening to Malaysia. Probably good morning to Dubai and other places. And today it's a World Music Day as well as an International Day of Yoga. So we have combined both, and today have formed a interesting web meeting. We would say it's not a webinar, not totally academic, not totally talk show. So we have various experts. Our host will introduce them to you, and we have our respected Vice Chancellor, Professor Dr. P.V. Vijay Raghavan, and Dr. Armugam, the Director of Center for Sports Science at our Sri Ramachandra University, and Professor Rupa Nakarajan, who's the academic officer of our university, as our chief patrons and guests of honor. I would like to request them to offer a word of inspiration for this meeting. Then we'll start the meeting. Professor P.V. Vijayaraghavan, sir.
Thank you, Dr. Tyagarajan. Again, congratulations on keeping the whole day busy on the International Yoga Day. I am very happy to make these opening remarks. I think it's an excellent initiative where I welcome all the international participants who are going to give their views, and also the local faculty coordinators who have actually done this. Actually, the two themes under which this particular program has been organized is basically on music therapy, music and yoga. I think two important components which are actually able to integrate the mind and the body so very well. Even when you are extremely tensed up, and I think Tyagarajan can stand proof to this, that you immediately divert yourself with the tune of a film song or a Carnatic music, I think your tension automatically goes down. So I think music is a very important component, and it is in the rightness of things that SRIHER Fitness Club has chosen this along with yoga, because no single therapy can solve all problems. All allopathic doctors should understand this, that no single therapy can really cure or sort out all the problems. I am reminded, and I'm always fond of introducing newer and newer programs. There are universities which have started giving degree programs in music therapy. So now is a time that and I must really recognize that through the HR department on an annual basis, our university conducts a music program almost on a competitive basis, and then goes on to end up in a finale where we have seen excellent singers coming and giving their performance. So it is not new for Ramachandra to be practicing music. We also have the Fine Arts Club of the students, and who consistently perform in culturals and many other activities like that. Ultimately, but we need to structure and bring all of them under a banner. And that's exactly what Tyagarajan is trying to do right now in getting hold of experts in this area and all these things. I still remember Apollo probably came up almost 15 years back. Music therapy during the labor time, during the delivery time, actually improves the intellectual level of the child that is born. I don't know how they were able to prove this, but this was one of the literature that came in long time ago. So there is a lot of possibilities, not only of practicing music, but also of researching in terms of what exactly this can do. I'm extremely happy to actually be part of this program, and I wish all the very best and all success towards this program. Thank you very much.
Thank you very much, sir, for your inspiring words. Next, may I request Director, Center for Sports Science, Professor Arumugam, to offer a few words, please. Sir, please, you need to unmute, sir.
Dear Vice Chancellor of University, Professor V. Vijayaraghavan and Professor Rupa Nagarajan, Madam, as well as other panelists and faculties from international countries. So it's a unique concept. I was very happy when Tyagarajan brought up this. We all love music, and we'll be very interested to know how music can be as a therapy. We heard of that also, as our Vice Chancellor mentioned. Maybe during this panelist discussion, we'll have the scientific basis of calling music therapy. And as anybody else, I am also very keen to know the outcome of this important and interesting meeting. Wish you all the best, and waiting to hear from all of you. Thank you.
Thank you, sir. And thank you for proving this as a part of the Indian Association of Sports Medicine's initiative. As a president of IASM, we owe our thanks to you also, sir. Thank you very much. And Madam, Dr. Rupa Nagarajan, your kind words, please.
Thank you very much, sir. Respected Vice Chancellor, Dr. Arumugam, sir. All these fabulous panelists who are experts of their own in their own areas, Dr. Tyagarajan, and to all the people who are attending this program. I think it's a terrific idea to combine on such an important day, Yoga Day, as well as Day of Music. So I think it's a fantastic confluence. I come from the Department of Speech, Language, and Hearing Sciences. For those of you who don't know where I come from, I'm a speech pathologist, audiologist, and our department has had a very deep interest in music, because I really see musicians, especially vocalists, as vocal athletes. They need everything that an athlete needs. They need strength, they need stamina, they need endurance, they need range, they need flexibility, adaptability, fitness, and focus. And I think most important, they need to understand, like everybody else, what are their strengths and what are their limitations. And so it seems to be really nice that it's coming under sports medicine. This program is being held. So I was quite a thrill when Dr. Prakash spoke about this to me a couple of days ago. Our own Department of Speech, Language, Hearing Sciences, about 15, 16 years ago, we started working with musicians, mainly because we were working very closely with the ENT department, and Chennai is the cultural center of music. So we get lots and lots of musicians. And when these musicians came, they had two fears. They didn't want to have surgery, or they didn't even want to take medication because they would think it would impact the quality of their voice. And that's where the ENTs and us began to work together to see how we could improve, their voice with in the best manner and the most efficient manner for our clients. So many of them were musicians. And our voice clinic grew out of that. And the strange thing is, as much as our voice clinic handles people who have problems with their singing or voice, much of the focus has been on vocal health, much of the focus has been on, making better use of what you have. Though I must say that today, clinically, Ramachandra is known for the India Protocol for Voice Assessment, the India Protocol, and all the tools that many voice therapists, speech therapists use for assessment of voice have all originated out of the research that has been done in our department. So we're very proud of that's being used all over India today. But I think our greatest learning came from a certificate course we actually conducted along with Madras University. It was an interesting triad. We had the ENTs, we had the speech pathologists, and then we had the musicians. So this triad, really helped each other learn, and we conducted a joint program for many years. And out of that came, much of our experience. And then we started conducting these programs for ENTs and speech pathologists together called Voice Updates, which always had a section on voice. And then within our own university, we offer a very popular elective on voice. So given, and of course, we also offer all our teachers in our college a session on voice care during the faculty development programs. But I think our forte has been, voice care or outreach. Prakash is a very popular representative of India in the World, Voice Forum, where on April 16th every year they have music and other programs right through the day. And also that we have taken the opportunity, thanks to our musicians requesting us, to provide programs out in the community. And we've had several programs during the music season and even otherwise, talking to musicians about how to take care of their voice. This has been a whole lot of public programs, and given all this that we have done, I'm so glad that today we have the confluence of yoga and music, because to me, they are natural partners. They're both very Indian origin, very traditional, and take care of the way our systems work, the way our musical teaching goes. So there is a lot to do with yoga and practice. And some of the approaches that we use that Prakash recommends are very holistic in nature. They involve, not only all systems, but also, practices that you would say are adapted from yoga. So I'm very happy to be here today. And I know Dr. Tyagarajan has got very vested interest. He's a great musician himself. And then he also likes to be a part of sport, as well as he likes to be a part of, taking care of his voice. We have seen him in many of our voice programs ourselves. So I'm delighted to be here. And thank you so much, Dr. Tyagarajan, for asking me to be a little part of this program. I'm sure you'll have a great day ahead. Thank you.
Pleasure, ma'am. Pleasure, ma'am. Thanks for the inspiring and exhaustive information. It's very, very inspiring. And with your all your blessings, we'll go into the program. We have today Vaishnavi, who is a doctoral scholar in speech and language hearing sciences. And we would to introduce Vaishnavi. Her voice adorns all the university programs because she has done the invocation song. And Vaishnavi, can you say hi to all of us?
Thank you so much, sir. And it's wonderful being here in the presence of such distinguished experts in their own fields. And I'm really excited to learn more and more about yoga and music and how it affects the body.
Thank you, Vaishnavi, for joining in a short notice. And our other co-host is an obstetrician. She is going to join. She's in an emergency medical procedure. She might join soon. And then we have to have the pleasure of introducing our panelists now. We have a trio again, three wonderful speakers, Dr. Garry Kuan from University of Malaysia, and Dr. Prakash from our own SRIHER Institute of Higher Education, and then my good friend from Middle East, Dubai, Mr. Raj. I would love to hear from them rather than my introduction. Dr. Garry, could you please introduce yourself, please?
Hi, everyone. My name is Garry from Malaysia, and I'm a sports psychologist, whereby I use a lot of music to help athletes and also in helping well-being as well. So it is an absolute pleasure and happy that I will able to come to this panel that able to share on my favorite topics by using music and also in the yoga perspective. So thank you for the invitation. Thank you.
Lovely, Garry. Thank you. And I love all those guitars and the string instruments on your background.
Thank you.
I know you're a fantastic string instrument player also and have your own orchestra. And
yep.
We'll talk about it more later. Thank you.
Okay.
Great. Now we come to the second of the list, Dr. Prakash Boominathan. Dr. Prakash, about you, please, to the audience.
Good afternoon. It's a pleasure to be in the panel. Thank you very much for inviting me. Prakash Boominathan, Professor and Head of the Department at Speech, Language and Hearing Sciences at Ramchandra. My specialization has been on working with professional voice, particularly the vocal music. And in our institute at Ramchandra, over the last decade and a half, we have tried to understand the dynamics of our singing, particularly the Carnatic genre, a little work in Hindustani and light music singing also. And it's really a nice thing. I keep, asking Dr. Tyagarajan if there is a possibility to understand the laryngeal biomechanics in his biomechanic labs. And so if there is going to be some way to collaborate, I would be feeling very excited to do that. Thank you very much for this opportunity. Look forward to the discussion. Thank you.
Great, Dr. Prakash. Anyway, let this academic program can be a harbinger or a spark for this all this research, collaborative research. Thank you so much for being here. And the last but not the least, one of my closest friends, who's a structural engineer in Dubai, and he's going to talk about the engineering of the voice, mainly the singing voice. Raj, could you please introduce yourself? Raj, are you there?
Hi, I think I'm having some connection issues. Am I audible?
Yes.
Hi everyone. It's a great honor and a pleasure to be here in this WebMeet this afternoon. And my thanks to all the dignitaries, and my thanks to IASM who organized this meet. It's a great platform to listen and share our experiences with music and yoga. Well, to talk about myself, my name is Raj Naidu. I'm a vocal trainer and a voice expert. I put up a program called as Vocal Yoga, which I've been doing for the past 5 years. Basically, I'm a civil engineer. I'm into construction business. I run an architectural and a construction firm, and vocal yoga and music is a passion.
Okay, Raj, great to have you here. So with this, let's start the first innings. So probably I'll get the first bouncer to none other than my friend Prakash. Dr. Prakash, when you mentioned that singers are athletes, and you mentioned about the term vocal ergonomics, vocergo. So I'm really fancied about that term. And what is it actually, vocal ergonomics? I've heard about office ergonomics. What is it?
Thank you for asking this question. And that's what we've been trying to work for the last so many years. So voice is used by every one of us and by singers in more refined, sophisticated manners. So I would think possibly there is a combination of a psychological element, there is a cognitive element, and a biomechanical element. All these three have to be combined in a particular way that the singer will be able to produce the best out of him. So to get the maximum out of these different systems of the body and the mind, we combine aspects of empowering the mechanics of these systems, how they work, what are the risk factors in this, how it may get affected, what are the other factors which may contribute to the betterment or the detriment of the voice use in singers, and empowering them with this knowledge and skill, hence developing a different attitude to deal with voice problems. As I said, vocal athlete means athletes have liabilities of getting injuries. So one should not fear about the injury, but rather find ways to rectify them quickly. And vocal ergonomics basically empowers the singer and the vocalist to basically look at these aspects so that they know how to handle it at the earliest possible to prevent further damage. That's what is vocal ergonomics.
Thank you, Prakash. It sounds so fantastic, actually. And you have promised me that you will raise your voice because you are not audible. Great, okay. Yeah, your voice is very soft. I know that you are a very soft-spoken man.
Right.
For the purpose of this conference, you are going to be loud for at least.
I will. Okay.
Thank you, Vaishnavi. Do you have any questions for your senior HOD?
Yes, sir. So, sir, you spoke about you used the term vocal athlete. So, as a singer, how is the vocal instrument different for a singer, and how is it special in case of a singer?
So when you look at the specialist way, the way the singing mechanism is made for a singer, there could be multiple ways the singer may be different from a non-singer. And this could be either biological or an effect of training. And we really do not know what is leading to one another. Okay, it could be because of training that the biological systems undergo a change, or by nature they are bestowed with certain capacities. So when you look at the laryngeal instrument, the larynx itself, we find that the spacing of these systems are little more or wider when compared to a non-singer, which gives more room for the vocal cords to move more flexibly. So we call that cricothyroid space. And so an expanded cricothyroid space is a mark of a trained singer. So they know how to use that. Second, the muscle endurance. The muscle itself is more stronger when compared to a non-singer. That could be because of effect of use, or it could be because of training. Another important difference in the vocal apparatus itself, if you see, the way the vocal cords, there are two vocal cords, there are two strings which come together to produce sound. And the way they come together, the speed with which they collides, and the symmetry, the right and the left, has to get in phase, and they have to be perfectly in sync for them to arrive at the right note, or to sing in synchrony with the instruments when they are singing in with an orchestra things. So that delicate balance, how do they get the vocal cord actually in good sync, is again something which the singer gets versus a non-singer. When a non-singer happens, there could be a random landing and off pitch. They may think they're singing, but they will be off pitch or off beat a little. And so all these are some things which happens in the vocal cords. Apart from the vocal cord, I think the respiratory apparatus and the resonatory apparatus tuning is also very special in singers when compared to non-singers. So these are some of the differences which you can notice. And as I told you, these are biologically disposed as an advantage by nature, or many of these can be trained as well. So an interest in singing is good enough to start learning to sing. And so once you have that, you can develop your system.
That's great, Dr. Prakash. And Vaishnavi, thanks for putting this nice question. Now we'll jump to our next expert, Dr. Garry. Dr. Garry,
Yes.
In sports medicine, we have heard that exercise is medicine, but
Yep.
you are a proponent of a concept called music is medicine. Music is
Yep.
medicine as a therapy for health as well as sports performance. We are really fascinated. Could you talk about this topic, please?
Wow. Okay. Thank you very much. Nice to meet everyone again. So as mentioned by Dr. Prakash, researchers have suggested that music can be carefully selected to match the requirements of activity and characteristic of both individuals and groups, right? So in order to produce significant impacts in the sports enhancement, motivations in health, and also in sports. So there's been increasing more evidence, we can show it later, on selecting the right type of music that can lead to higher frequency, higher intensity, or duration of the sports and exercise behavior. So for example, our study shows that if by using music the right way, music able to reduce the perceived exertion, like running exertion, on an average of a low to moderate intensity of exercise, they can reduce approximately 10% of rating of perceived exertion. So if the music actually well selected to match the individual's preference and also the intensity of the exercise, it can also reduce an average of 12%, 10 to 12%. So maybe later I will be able to explain more in depth on the mechanisms, how that music actually works so miraculously. Yeah, and it is really fun by using music the right way.
Great, great. Vaishnavi, you have any questions to Garry?
Dr. Kuan, there's a lot of research that's been going on with respect to the effects of music on different aspects of our lives. So, what are some of the proven effects that that music has on the human body? How many of them are proved, and what are the other effects?
Yeah, we
Yeah,
are
it's
from
very
a scientific
interesting.
university. We'll want proof.
Yeah, you want proof? Yes, yes, yes. It's really interesting, right? In fact, in our body, we actually music is part of our body nature, right? So our body responds to naturally to our breath, our movement, and heartbeat. So we create a beneficial effects, like we call it an ergogenic effects in sports performance. So it actually helps to increase, for example, we want to control arousals during sports or increase our work output so that we can able to go exercise longer, run further, lower your perceived exertion so you have less tired, lower your blood pressures, or even higher, increase your blood pressure as well. So it gives us more a natural, efficient physiological functioning that it will able to help us into more exercise flow state. So later, we definitely were able to see that music's able to help more important, especially during this COVID-19 pandemic as well, whereby when people stress, music's the right types of music able to help us to reduce our stress level as well.
It's lovely to hear, Dr. Garry. And then now let's come to our other expert. Since you two have taken a new subject each, like you have taken music for health and sports, and then Dr. Prakash has spoken about vocal ergonomics. Now we come to a person who has probably invented the term vocal yoga. So Raj, could you talk about vocal yoga? What is it, and have you discovered or invented it? In that case, have you patented?
Hi.
Are you the owner? Can you deliberate about it?
Okay. As the name suggests, it's a form of yoga. Like, I mean, vocal yoga is basically yoga. But then it's also an exclusive program that incorporates the use of ancient practice of yoga with modern Western voice methodologies to transform your voice and singing. Actually, vocal yoga is much more than singing. It's a journey of self-discovery. You will shed layers of fear and gain confidence in all areas of speaking and vocalizing. And your second question is whether I invented it or something. I didn't invent anything. I just discovered the right drops from an ocean of knowledge to make a small concoction that works faster and effectively.
And what about the patenting? Have you patented it? You are the owner of it? The technique?
No, how we can patent it? No, if you see, yoga is widely popular in all the countries. No one can patent anything. It's all the knowledge has been given by our
So in
ancestors.
case you are patenting it, please accept me as a partner. I want some money.
Definitely.
Great, Raj. Vaishnavi, we would like to grill Raj.
Yes,
with your
Mr.
question.
Raj, I would like to know what would you say are the different elements of singing, of music?
Okay, that's a good question. See, when we talk about singing, there are various forms of singing. You have classical singing. You have,
I'll have to mute some participants. Let me just, yes. You can go ahead, please.
Yeah. So when we talk about singing in general, we can take filmy music, the most commonly used one. So when you talk about a song, when you talk about the singing, there are 7 elements which should be there in a song, in any singing, which is timing, scale, breath, pronunciation, the nuances of the song, the right emotion, and then the overall beautification. These are the 7 elements of any song. And we work on these elements actually in our program.
Nice to know about this, Raj. In fact, Now, coming to music, let's not simply keep chatting. I'm going to play a song which probably Raj has sung, and then I would like to request our host Vaishnavi to sing a bit of Carnatic music, and let's see what is the so-called difference between this filmy music and Carnatic music, and let's see what are the elements and how they differ. Let me go to see and present a video. Just give me a minute. So you should be able to see. Are you able to see?
धीरे धीरे से मेरी जिंदगी में आना, धीरे धीरे से दिल को चुराना, तुमसे प्यार हमें है कितना जाने जाना, तुमसे मिलकर तुमको है बताना।
ओ धीरे धीरे से मेरे जिंदगी में आना, धीरे धीरे से दिल को चुराना, तुमसे प्यार हमें है कितना जाने जाना, तुमसे मिलकर तुमको है बताना।
So that's Raj for you guys. So that's so-called filmy music, Hollywood, Bollywood, or even Collywood. And now may I request our co-host Vaishnavi, who's a talented Carnatic artist.
Yeah,
Vaishnavi,
so
could you?
I'm only trained in Carnatic music, so I'm gonna do what I only know best. So I'll just sing one line of a Carnatic
More,
song
please.
composition. Yes. भावयामि गोपालबालं मनसेवितं तत्पदं चिन्तयेयं सदा। भावयामि गोपालबालं मनसेवितं तत्पदं चिन्तयेयं सदा। भावयामि गोपालबालं मनसेवितं तत्पदं चिन्तयेयं सदा।
Oh, I can't have enough of it. It sounds so divine. Thanks, Vaishnavi.
Thank you, sir.
So probably are going to explore the details within. So elements of music, and then can we ask about what factors really do influence this kind of voice, Dr. Prakash, from physiological points?
Sure. So after listening to Vaishnavi and Mr. Raj and his partner who was there in Smooth, so now the question, as you say, what brings this beautiful sound? Okay, so I would think factors which may influence voice when you look at it from a physiological point, I would think at least two things. One is the constitutional, which is biological in nature. The person's biological dispositions, which he possibly acquires across generations, okay, forefathers, and so that is one disposition. Second, I would think the age of the person itself. So it has both it is to do with the age at which training began, the way the person had an understanding of the voice production, the connect the person has with the sound. It could be listening to the sound to producing the sound itself. So the age And the age should also be seen as another factor, as how the voice transforms as the person grows older. You know, from a child to an adolescent to a young adult to a little older adult and much older adult, how the changes go through. And these changes are different for men and women. And so how this will make a difference to the person's thing. Another important aspect for the voice is the way the voice is used. So now when you talk about the use, you have to talk about two things: the habits, which is sometimes called as vocal habits, the way the sound is produced. You know, many times the throw they have on the voice, the effort they put to get the sound, the synchrony they get in the voice production mechanisms, how effectively they coordinate and efficiently, you know, manage the advantages of the system. So that is one. Second is the non-vocal habits. It could encompass several factors like food, lifestyle, the sleep habits. So many things are factors which can affect the voice from a personal point of view, that is constitutional in nature, and personally the person's liking and disliking of certain things around him. Another equally important aspect which shapes the voice is the environment in which the voice is used. How he or she cares about using the voice. You know, many times once you are a singer, you get all the popularity, and every time you are around people, the first thing is they ask you to sing. You know, because you are gifted, and people think they love to listen to you, so they would want immediately to ask you to sing. Whether you go to a birthday party or a general another party, or you go on a road trip, on a vacation, you're all the time singing. So how you are using your mechanism in these different environments, and the caution you might exercise so that you don't cause much damage to the system, but rather use it in the most efficient way. So the environment influence on the voice has a tremendous effect. And in vocal ergonomics, we actually sensitize these different factors also. You know, what all you can take cognizant of, be aware of, and control how much you can exercise control on those. So that is another aspect. So one is biological, second is personal, and third factor I would think is environmental influence. And these factors probably has a profound effect on the way the person uses the voice.
Excellent, Dr. Prakash. Vaishnavi, over to you for bombarding.
I'd like to ask Mr. Raj. I'm very interested in this vocal yoga. So can you tell us more about the benefits of vocal yoga?
Benefits. See,
as also side effects. Is there any side effects like medicines? We are always worried about side effects.
Yeah. See, as the name suggests, vocal yoga is aimed at enhancing one's voice and singing ability. So we can see people with various kinds of complaints. The normally, you know, singers, they say that my voice is very coarse, it's very thin, I can't reach high pitch, I can't reach low pitch, my timing is bad, my sense of scale is bad. And if at all I have to think about one person who had all these problems, that's me only. So you just heard my song now. If you can accept it as a singing, I was completely, how to describe myself? I'm a, I should call myself as a dumb person. What dumbness is to a speaker, to someone who can speak, I was musically challenged, in fact. So that's it. Vocal yoga, definitely it dramatically improves the way you speak, the way you sound, and the way you sing. And yeah, the side effects, like every the medicine, yes, it does have side effect. If at all I can pack vocal yoga in a box, I would print these side effects on the back. The common side effects are, it will give you a health boost. It will increase your lung capacity, blood oxygen levels, and the common respiratory problems like common cold and throat infections, it will vanish. It's a great meditation tool. It helps you find anxiety, depression, stress. These are the side effects actually.
That's wonderful. Wonderful to know that the side effects are actually positive.
I thought it was a negative side effect. Okay, I guess it was a positive side effect. Thanks for putting this question, Vaishnavi. And singing and speaking, are they really different? Sometimes the singing voice sounds different, speaking voice sounds different. Can we ask probably Dr. Prakash about this, the physiological part, how singing and speaking, the voice differs?
So as speech pathologists, we deal with the same mechanism, larynx, which is used for both speaking and singing. And as you rightly said, speaking and singing are different in many ways. And to say one of the fundamental thing is, I always think a person who can speak well will also have the capacity to sing well. So speaking is sort of the first step. So only when somebody can walk, can he think he can run. So singing is more refined use of the same instrument. Speaking is more natural. The differences, if you see, I would say first is in terms of the breath control. The way the breathing apparatus is used for singing versus speaking is different. Singing requires more delicate balance and control of the breathing mechanism. And then that is the first fundamental difference. The second difference is the way the pitch and volume when you're talking. So when somebody talks, there is a tone and there is a volume in the speech. And the same thing is there in singing also, but in speaking it's more intertwined. The speaking voice pitch and loudness are interlinked. So when you increase the tone, volume also increases. And when you talk softer, the pitch lowers down in speaking. Versus in singing, the singer has to balance these two independently. Any change in pitch should not necessarily cause a change in volume. A change in volume should be done without changing the pitch. Otherwise, what happens is he'll go off key. So it's very important to control the volume and pitch independently for a singer. The third important attribute which differs between speaking and singing is the quality control, the tonality of the music. And so depending upon what kind of song you're singing, okay, what Raj sang versus what Vaishnavi sang, there was a difference in the quality because of the nature of the song itself. The content of the song, the bhavam which it evokes is different. And so automatically the quality of the tone is different. While in speaking, there are changes in quality when you're angry versus when you're happy, but the amount of voice quality does not change too drastically. So that is a third important difference between speaking and singing. Fourth important thing I would say is rate, the speed of delivery. In singing, it's pretty much controlled. It is tempered. You have a beat and you follow that beat. Whereas in speaking, the tempo is very erratic. It keeps changing. It changes depending upon your listener, it changes depending upon your mood, so many things. Whereas in singing, when you're singing, it is usually metered, you know what you're going to sing, and so that automatically
especially when you talk to your wife and all, it's different.
So the rhythm and the speed varies for speaking and singing. There are several differences I can go on, but I will stop with the next one important thing is the clarity of the tone, the pronunciation. Okay? In speaking, even a casual talking is still acceptable, unless you are a public speaker or you're a teacher or you are where you have to care about how you really produce a sound. But for a singer, it is very fundamental. If a singer cannot say the words of of a particular language, whichever language, whether you're singing Hindi or Marathi or Kannada or Malayalam, you have to use a native tongue and you have to be able to pronounce the sound in that sense only. So that diction and pronunciation is so vital for a singer, which actually brings that the aesthetics of the song. And if you do not learn to produce that correctly, then despite having a great voice quality, your music will not be, vocal music will not be appreciated by people. So at least these 5 different ways, I think, speaking and singing could be different. And all of these are trainable. The moment you care about this, you will know how to get it and get control of these things.
Great, Dr. Prakash. I wish to become your student now because such a lovely wealth of information. And I know you have a good lab also. I want to get my voice tested somehow, like how you want to use our biomechanics lab. We will come to your lab. Thanks, Dr. Prakash. And Vaishnavi, talking about vocal ergonomics to Raj, can we ask him whether there are any qualifications that one has to have, any particular requirements, whether he'll reject people who cannot do vocal yoga? Is it for everyone? Raj?
That's a good one. I think,
are we not eligible, or as you said, we are disabled, something like that?
No, this is basically for singers and speakers of all levels. Like it was partly answered by Dr. Prakash in his last question. He has put what is a singing voice and what is a speaking voice under a microscope, and he has given us a very, very clear picture on what are the common problems, how people suffer from shortcomings in both. So it's basically for singers, beginners, intermediate, advanced, and for anchors, for people with specific problems that I spoke about before. But then, like you said, the basic qualifications, yes, there are some basic parameters to be met. Like, for example, if people go for a speech therapy, so you should be able to speak to go for a speech therapy. At least you should be able to produce some sound. So you can't make a dumb person speak. Similarly, for vocal yoga, you need some basic parameters. You need to have some sense of music, some sense of timing, shruti, and all these things. I wouldn't say that everybody can be trained to sing. So you need to have something. If you have a little, we can magnify it. But if you come with nothing, we can't do it anyway. So we do, actually, I do have a screening process on whom I should train and whom I should not.
Okay, now I remember seeing a movie, Ratatouille. Anyone can cook. The rat will say beautifully. So I thought even rats can sing. Why not? When you come to a trainer like Raj and...
No, there was one exception for this. There was only one exception. One person who didn't fall in any category was trained to sing, and that's me. So that's how it started.
Great. Sometimes we experiment ourselves. Great. Super, Raj. And Vaishnavi, Dr. Garry has been silent for quite some time. Please attack him.
Dr. Kuan, I'd like to ask you, is there a way to select music while practicing yoga or for any sports activity? How do you select what kind of music to be used, to be played?
Yeah, it's quite interesting, right? Singing and music is slightly, but singing is also considered one part of music. But how we select music is slightly different for physical activity or for yoga. For our research, we actually suggest using like a rating scales, whereby we use like the Brunel Music Rating Inventory Tree. So what is actually Brunel Music Rating Inventory Tree? So there's like 6 questions asking about the rhythm, the style, the melody, the tempo, and also the sound and the beat of the music. So for example, does the rhythm of the music actually helps to motivate us during yoga? Does the style of the music or the melody of the music helps to motivate us during a yoga practice? So we can use the Brunel Music Rating Inventory Tree or any music rating inventory that you can also use to rate music. Besides that, we also use a psychophysiological measure like hooking up them with an EEG. An EEGs that is very easy to help us to detect the alpha wave and the theta waves. The creativity is there, whether the get more relaxed from the beta wave, or maybe they get more tense. So that's psychophysiology will help us to complement with the rating skills that we will know that whether the music actually have an effects or no effects for the participant. Yeah, so we can use this.
Thank you, Dr. Kuan.
So thanks, Vaishnavi, for asking this question. Dr. Kuan, you probably have noticed that I have moved to my music living
Yes,
room,
a music room.
inspired by you and the
Yes.
Zoom.
I
Dr.
need to
Garry,
bring
do you have it?
better.
Great, great. Would you like to play that, or would you like to show some
Maybe next time. Yeah.
In YouTube, do you have any performance of your orchestra? Would you like to show us?
Sure. There's some performance we used to do it in USM. We can actually show you even our music, which is performed using singing as well. Let me quickly find it.
You can share screen, and you may go to advanced, and then in the advanced, you need to share the video.
Advanced. Okay.
Advanced and then video. And see to that the sound is enabled. Sharing sound is enabled.
Okay, brilliant. Let me share it now. It's actually disabled by the host. Maybe
I'll make you a co-host now, so
Okay.
you'll be able to do that.
Okay, brilliant.
Yep. Wow.
So can you hear? Yep.
That's
So
quite a
this
big
is-
orchestra.
Yes. So we do have an orchestra. It's actually from the medical school. So
Wow.
this is the only music faculty that our orchestra is only comprised from the dental, medics, and also health science student. So this is the only orchestra not in the music faculty.
Great,
So I'm the conductor. Yeah, we have the full orchestra here. So we are performing habanera.
Can you stop now and mute yourself, and then start sharing the sound? I don't think you have shared the sound. At the lower left bottom, in share screen, advanced.
Okay, let me try again.
Yeah. You have to share the screen. Then in advanced, you have to share as a video.
Okay, share screen.
Advanced.
I don't have advanced.
You will have.
No, you don't have to go to
advanced.
Thiago. It's in basic only.
Okay.
It's in basic.
Yep.
At the lower left.
Let's try again.
Yeah, please.
It's not coming up. Maybe I will share it later again.
Yeah, you can share it later. I think Mr. Raj has got rich experience in this kind of live sharing.
Yes.
He will call you or he will text you on WhatsApp in our group, WhatsApp group. Great. So we'll look forward to the orchestra. And I got really goosebumps by just listening to that. The medical, orchestra is entirely consisted of a medical school. That's really awesome. Fantastic.
Thank you.
So great. So I would like to ask you how it's helping music as a therapy in this current pandemic situation. How would you see it?
Okay. Well, I would say that it will be enormous, whereby due to this COVID-19, it is a tricky situations. So our body will actually have the autonomous nervous system, which activates during the fight and flight and response, right? So for example, if you see a tiger coming, what will you do? Your entire sympathetic system will be activated so that it will supply the energy to your body to run, hoping to outrun the tiger. So in this pandemic, unfortunately, it's lasted for a year, longer than a year. So our sympathetic system is keep on activated, but unfortunately, our parasympathetic system, which is to lower back our heart rate, to lower back our homeostasis, is no chance to be activated. Okay, so by using music, by using the right music to relax us and to reduce the parasympathetic system, that we were able to go back to the homeostasis of our body. So this is very important because when our is going so high, but there's no mechanisms that able to help us lower back our body. So body arousal system, so our fight and flight response will always be activated. So I will say that I will always use music to help our athletes and also general publics to reduce their arousal and also to reduce their heart rate, their respiratory rates back to the homeostasis. Yeah, so it's very important that we use the right music as a therapy, especially during this pandemic situation.
Thanks, Garry. So very comforting to hear. And Vaishnavi, would you like to again query your HOD, your boss,
Yes.
with some more questions?
Sir, I know that you've seen a lot of singers in your clinic. So I want to know, what are the signs that pushes a singer to take help? What are the symptoms that they see? And what are the symptoms that you see as voice disorder in a singer?
Okay, so if I have to understand the question, maybe we should say it as what may be the complaints, or what are the problems they may encounter, right? So one of the most common things which a singer often complains, the first thing is tiredness, fatigue. Tiredness is one of the major factors, and many times because of their enthusiasm and liking for singing, they tend to oversee that and in fact end up in a bigger damage because the system is fatiguing, which means the system is not used correctly. So it's getting into a tired zone. And at that time, a little vocal nap is required for it to recoup and then correct the correct way of using so that you don't end up in a bigger. So one of the major thing is tiredness. Second is not able to control the pitch. I'm always off key. When I sing in a group, my voice is heard separately. I'm not able to, and they spot me out separately. Or when I'm singing in sync with somebody, then there is always a little mismatch with me and my orchestra, the off pitch, off beat. So voice, that is one issue. Second important thing is control of the pitch itself. When I start, it's okay, but where later on I have to struggle landing at the right note, or producing the correct sort of pitch perfection. So that becomes a problem. Pitch control is another important issue. Third important thing is volume projection, voice projection. So that becomes also an issue for people sometimes. So they don't know how to use the resonance effect correctly, and then that becomes a problem. Another common thing which people can have is the discomfort or tightness of throat, the sort of physical sensations after singing, or after you have learned something, or after you have trained yourself, singing lesson. There's some sort of unease or discomfort, or so they can be. See, exercises can lead to certain pain, but that pain is different from a pathological pain. So when you are practicing music and you're singing, sometimes the discomfort should not be so much that you will start fearing to sing. So that is another major problem. Another common thing which they say is inconsistencies in voice. Today I can sing. I'm not sure tomorrow I'll be able to sing or not. So many times people can dispose that as just a psychological effect, but there could be physiological reasons also for these inconsistencies also. So both of these are some of the common problems which people come up with when they learn singing or while they are performing singing. So these are some of the common problems apart from, I'm not talking about all the different pathologies which can happen to any larynx. We want to keep the system healthy and fit. So these are some things which can happen because of use of the system itself. Okay. So learning to use it correctly becomes very vital and important.
Thank you, sir. I think I'll also keep track of these so that I can be sure that I'm using my voice the right way. My next question is to Mr. Raj. Would you consider that singing is an art, or is it a science? And also, do you think talent is inborn, or can it be acquired?
Okay, let me take it one by one. The first one is an interesting question. Singing is a science or art? I used to ask my students as well very often. Okay, now Vaishnavi, as a singer, which one of these do you think closely matches singing? Your opinion?
I would say it starts off as a science and then moves on to an art. But I think that is just my opinion.
It starts as a science and goes on. Okay, that's well said. Actually, it employs both aspects. It's a science as well as an art. So that's why I call it as a sport. Okay, singing is a sport. Music is an art. Okay, music is an art, but singing is a sport. Why? Because it's already, I think Dr. Prakash already explained this, all the physiological and the psychological aspects of it. Because like every sport, singing requires physical fitness and agility. Okay, it was like further explained by Prakash in many ways. The various organs, how you have to be fit. He explained in one of the questions. So physical fitness is one part, and the other part is the cognitive skills like perception, memory, judgment. So when you combine these two, any sport, you need to combine these two. Okay, so when you take singing as a sport, I think you can, your approach and your the results will be much, much better than learning it as an art. Okay, and what was your second question?
It was about talent, whether it's inborn or do you think it will be acquired, can be acquired?
Okay, again, I think this was also touched upon by Dr. Prakash. Naturally, some people have a good combination of the right set of muscles and tissues and the vocal arrangement. The various organs, they are blessed with some physiological and psychological aspect that helps them to become a better singer. But then if you ask me what talent is an activity which some people do effortlessly, and for other people it takes tremendous efforts. Okay, so when some people do it effortlessly, we call it as a talent. Okay, yes, talent is very much inborn to a large extent, but then it can be acquired also through training and practice. Yeah.
Super. I think it's a philosophy in, as such. We can do 2 PhDs on this, right? It's such a broad question. Very, very thought-provoking questions, Vaishnavi. Thanks. You have shown that you are a PhD student. You have asked 2 very good research questions, and thanks, Raj, for answering it. I would like to put the next question for all 3 of you guys, because you all 3 seem to have the same ideology, but a different methodologies. Okay, slightly different methodologies. So when the singer comes and complains about these problems, so what do you guys do for their singing health? What kind of exercise, what kind of therapy, what kind of yoga you want them to do? This is the question. So when the singer comes with a problem to improve his singing, what is the intervention that you want him to do through exercise, yoga? So that's the question. I want to put the question to all of you, because this question has been asked by my wife. From the next room, she WhatsApped me now, watching the YouTube. So I am putting this to all of you. Garry, to start with, please. Garry?
Sure. So if a singer comes, So I will say that similar to what Raj just said, sports is actually a combination of talent and hard work. Okay, so if you want to be an athlete, you want to be a singer, it's not just the talent. The talent can bring you so far, but it needs a lot of commitment, hard work, and practice. Okay, in order for you to go to be above somebody or to win a competition or to be in your flow state, being enjoy doing singing. So first you need to love the singing, you love the music, and then from there, I'm sure you will able to practice, right? So you will be able to practice, put a lot of effort. So for example, in sports training, we will say that why an Olympian athletes train 6 hours, and maybe our athletes also train 6 hours. But is it the same types of training? Is it the same intensity? It is the same commitment. It is the same discipline that they take in order for move forwards and also to outperformance others. So to sing, in order for you to able to open and to bring a big audience as well, it's not easy. It's a big task, and you need to actually opens up. You need to do a lot of practice, a lot of hard work, a lot of commitment, training in order for you to go to be a singer. So maybe Dr. Prakash can add on, or maybe to correct me in a different view.
But superb. The words they used, Garry, are fantastic. Like commitment, intensity, the passion. Yeah. This is more important. And practice. That makes perfect. So we got that from you. And probably Dr. Prakash can tell more specifically about of interventions.
As you said, all of us are working on the same ideology. We want to have the same outcomes, but the methods probably are slightly different. And the very essence of this WebMeet, is to clarify this and how we can gel together. Things will be great. Okay, so what I primarily look at is I work on two things: enabling and equipping. So what I do is I first find out what is their current level of performance. What's happening now? Okay, so when they start singing, what's happening? So they already have the liking for singing, they have the attitude to sing, they want to sing, they're willing to give that commitment and things, and they're hardworking and all that. But what are they actually doing? Okay, so once you get to an idea of what they're actually doing, then we enable these mechanisms to work in coordination so that you get a good orchestrated voice outside. Okay, how you sync the body mechanics to get the sound outside, which is acceptable for you first, and then your audience start loving to listen to that. So that is enabling. Equipping is preparing them for what may happen in future. Today you are doing this, but tomorrow there will be changes because you're doing something now. And there is a career goal for you. You want to be a singer, you want to perform on some stage, you want to do. So there are certain things which is required for the body to get toned and the mind to get used to for you to reach that level. So that is equipping that person. So enable them on the current level and prepare them for the future is what we do. And there are several gadgets which today's science allows us to look at refined ways, how these systems actually function, so that we identify which are healthy mechanisms, how this health gets slightly distorted or disturbed, when this health becomes pathological. So we can track these things, keep correcting them without inducing fear. The moment you are aware of what is happening to you, you go through that pretty comfortable. That's the idea. So that happens from things. And in fact, one of the greatest revelations I've always found with my singers is the moment they see the voice box. Voice box is housed.
Dr. Prakash, can you show us the voice box?
Lovely. I will be very
Not
happy.
Many of us would have shown.
One of the pictures which we have taken, we have a high-end instrument called the video stroboscopy, which allows us to capture the vocal cords in good movement. So how do I do that? I share my screen.
Yeah, you can share your screen, and if you have advanced options, you can select it and select a video.
No, Tiago, no need to go to advanced. Just
Okay.
in the share screen,
Ah.
in the basic
So can you see?
tab.
Can you see
Yeah.
the image?
Yeah.
Can you see a picture?
Yeah.
So this is the human vocal cord. There are two vocal cords. These are muscles, and there are false vocal cords which are surrounding these structures. So below this is your lungs. From there you push the air and sets the vocal cord into vibration. Look at the way the vocal cords actually vibrate. Can you hear the sound also?
No, you need to check, tick the box which says share sound.
Okay. So he's at
bottom left.
This is the singer's voice box, and the singer is actually going up the scale.
In the bottom left, you will have an option called share sound. If you click the button, the sound will share.
Bottom left.
In the basic screen, in the share screen basic, at the bottom left, you have a tick box which says share sound.
Okay.
Yeah, we are able to hear something now.
Yeah.
Able to hear the sound?
Yes.
So this is the vocal cords of a male singer, and he's going up the scale and coming down the scale.
Grossly, it looks very slow, but it might be reverberating at 1,000 per second.
So what actually happens is the vocal cords vibrate around 130, 140 times per second in a man, and around 230, 240 times per second in a woman. And for a child, it goes up to 400, 500 hertz. But our eye cannot see those fine movements. So this instrument, which I called as, which I said stroboscopy, allows us to capture that fast movement, resynthesize that into a slow motion picture, which allows us to look at frame by frame and see the depth of the vocal cord muscles. It's a very intricate, marvelous nature's creation. Given
It looks so. It looks again goosebumps moments just from a simple looking box. Beautiful voices like KJ Yesdas, SP Balasubramaniam, and other great singers. Oh my God! Thanks for showing it up, Dr.
Pleasure. Thank you. So that is what I said. For a singer, it becomes a big revelation. The way they look at, they've always heard the sound and they see the sound from the voice box, then it makes a big difference.
Fantastic. Thank you. Raj, do you have any points like what exactly do you intervene, exercise, yoga? Maybe not all, one or two main interventions.
Okay, see, vocal yoga works on two aspects, like I said before, physiological and cognitive. Okay, so when a person enters a gym, okay, and then when they meet a personal trainer, the first thing the trainer does is, they do an assessment of the person, where what they actually need, where which muscle groups need to be focused on. So like this, we first do a basic assessment, and we work on physiological as well as the cognitive skills. So we have various training methods for both of these.
Yeah, great. And among these, probably if I can ask you more specifically, any particular asanas or methods in yoga, like Bhastrika, there are so many types.
Yes.
Which one you have, in your experience, found most useful for singers? Which yogasana?
See, it's very difficult to give a name, because what we have done is we have worked out a program for about half an hour, which involves pranayama, and which also acts as a meditation as well. So this half an hour is we have combined various asanas like Bhastrika, Anulom Vilom, Simakriya, Kapalbhati. So it's a combination of all these asanas and various other techniques. It's not, I won't say that, okay, one asana will straight away help in singing. Actually, it's a very carefully selected array of
I know.
asanas and postures.
I'm being very jealous and ambitious, I know, but still the public would like to know, is there any single panacea asana which can improve their voice
See,
box?
when you say that way, any kind of a pranayama will increase your lung health. It will increase your energy levels, and it will improve your breath control and everything. But I can't just say one asana will help or this asana will help, because that's exactly what we teach in our classes. It can't be answered in the question like this. So please come to our class, and then you'll be able to see it.
Okay, great, lovely. So next questions, my co-host, is she there? Vaishnavi?
Yes, sir. Yeah. I'd like to ask Dr. Kuan. So a lot of people use music while playing sports. So can the same music that is being used with sports, can the same be used to improve mindfulness in yoga sessions?
For using sports and to use for mindfulness training, I think both will be able to incorporate. As we mentioned just now, the purpose of using music is very important. So why you select music? Do you consider the internal aspect and also the external aspect of music? So if we're able to gel both together, and the purpose of music for using sports and also to help, especially to enhance mindfulness, in yoga sessions, it will be more further enhanced as well. So I will say that both will be able to apply the same principle, but we will need to use on a different purpose. Okay, so more importantly, we select music according to the purpose of why we want music, in order for helping us to enhance more workload, more psychophysiological workload, and also more auditorium motor synchronization, whereby we're able to synchronize music with activity and also for yoga as well. Okay, so it depends on the purpose of music. I'm sure we were able to use the music for the right purpose, which is for yoga or even for exercise setting. So the music slightly different, but it can be used for it as well.
Thank you.
Thank you, Vaishnavi. Thank you, Gary. I think we have had 1 hour of good interaction by the host to the experts. Now it's time for the participants who have eagerly participated and put up some questions in the chat box in the YouTube, which we have gone live. So I might read a few questions. And one, Mr. Ramdas M, he has asked Raj about is there any capacity for ragas to heal? Have you done any research whether it improves immunity? And because it's important in pandemic condition. And what are the elements and steps that constitute a vocal yoga? So you have spoken about vocal yoga, and he has gone one step higher and is asking whether they have healing properties, whether the ragas have healing properties, immunity properties. So again, someone who's very ambitious like me. Mr. Ramdas.
The first part of the question is yes. Ragas are believed to be having healing properties and therapeutic properties, and a lot of articles have come, but I don't think anyone has scientifically proven it. Even ragas are believed to bring rain, and so many things we have read. But in general, when we listen to some particular song, we could feel that our mood is enhanced. We feel more happy, or we feel more energetic. I'm sure every one of us have this experience. Some particular song, some particular composition, some particular genre, some singer, some composer. They all tend to bring up a lot of change in us. So here goes the proof. Of course, ragas or some particular form of music, definitely they have healing properties.
Great. What about immunity, Raj?
experienced it. So, come again. What is the question again?
What about immunity? Can it improve? Because pandemic, we need immunity.
What is the question again?
What about enhancement of immunity through? Yeah, immunity through this singing or vocal yoga.
Yeah, immunity through singing. I wouldn't say that. Okay, you can develop immunity through singing, but then if you go through the training program, the practices and the modules which are offered in vocal yoga, definitely they are immunity boosters.
Okay, great.
100% they will boost your immunity. Like I said, these are side effects of vocal yoga. Immunity boosting is one of those.
Okay, good. And the next question is by Dr. Prakash Ramurthy, my good friend from Coimbatore, is a plastic surgeon and a wonderful mule singer himself. So he's asking a very important, nice questions like, what defines a good singing voice? He has quoted that some people from Western who are leading singers, their voices don't appeal to us. Similarly, probably some Indian singers, the Western people might not feel it's very appealing. So what defines a good singing voice? And probably one of you can answer this thing. Dr. Prakash, do you have an answer for this?
Sure, sure. So voice is actually a cultural construct in a way. So it is very culturally defined. So the voice which is used for the singing also reflects one's culture. So what you're used to hearing, you feel more comfortable and you start liking it. And so many times, for every child, the mother's voice is always pleasant and nice, irrespective of whether the mother can be a singer, not singer, however her voice is. So what you are used to hearing, you automatically start liking it over time. So, what sort of exposure you've had from your childhood to understanding of what you like and how you think. So based on that, possibly the perception of some voices of the different genre is not so appealing. But from a physiological point of view, I would like to say what defines a good singing voice. This is very difficult to define it into a box, but I can say certain parameters definitely say that this is a voice which can actually sing or which can actually produce a singing sound.
Like 1 or 2 parameters,
yes,
can you
put? One I would think is a bright, bold voice which has good sync of pitch and volume, where the person can actually know how to modulate these two correctly. That is first thing. Okay, I'm only talking of the production. Perception is important. What you hear, only you will produce. If you're not able to hear it, then production of those fine nuances, it's very hard to.
Generally, we are talking about
is the endurance, the strength of that voice, the strength and the longevity the person can sustain. Again, shows something which is short-lived. Usually, will not stand the rigors of singing. So that is important for that. So that's something which again identifies as a strong voice which can become powerful.
Very apt.
Third is using the resonators, all the musical instruments. I would think our voice box is also a musical instrument. Okay, nature's given musical instrument, which is used both as a wind instrument and a stringed instrument. You combine these two. So all the wind instrument and stringed instrument has resonators. The resonators only quantify or qualify the sound which comes from that musical instrument. Same way, if a person can actually discover the resonating spaces and use it correctly, that person's voice will be beautiful. Be it speaking or singing, it's very important to use that resonance correctly. So these 3 parameters.
Superb. And another participant, Dr. Radhakrishnan, a lot of doctors attending today. He has asked, can you change the voice through practice? Is his question. Can somebody change the voice, the tonality, or the way by some exercises or something? For example, I don't like my voice, it is too nasal or something. Can I change it to a more deep sounding SPB type of voice?
You're asking me? Okay. So
I'm asking myself. I'm asking you, Dr. Prakash.
right. Okay. So we can change voice, but there are limits to the change you can possibly do. As I told you, from a guitar, you can only produce a sound which comes from the guitar. The same string is there, similar string is there in Veena, but the sound of Veena is different. So it's very important for them to understand that biological mechanism, what are their limits, and you can meddle within the limits. You can beautify it. You can take the natural advantage which comes to you naturally, discover that and showcase that better. Then automatically it becomes
Start loving your voice and improve it. Great.
first self-discovery, right? Correct.
Fantastic, fantastic. Thanks, Dr. Prakash. And I think there is some more of questions. Is chanting of Om is also a vocal yoga? Is another question. Raj, would you like to comment on that?
Yes, it is. But
It is.
there is a way to do it. We are, it's not like yes, Om chanting definitely helps, because Om chanting is nothing but it's a universal hymn. It's the sound of the universe, they say. So over the period, they have made it as a religious practice, so that everyone would do it in their. Yes, in vocal yoga, we have a very powerful incorporation of this Om chanting. Yes, it does. The answer is yes.
Okay. Can we train a non-singer through practice to a singer? Is Dr. Radhakrishnan's question again. I think, Raj, you have spoken about it. Almost you said that you used some nice term like music disabled, whatever, musically challenged. So musically challenged people can be, through practice, can be made to be singers. Non-singers can be made to singers. Raj, your opinion about that? Whether non-singers can be made to become singers?
Whom are you asking?
I'm asking you, Raj. You can answer, then I'll ask Prakash also.
You are asking an example. So
okay, got it. And Prakash, Dr. Prakash.
So that answers it.
In fact, my PhD was on this.
Oh,
I tried to understand trained singers, untrained singers, and non-singers. Okay, and I looked at their vocal dynamics, though from a vocal health point of view, and that was my PhD research. I didn't discover a quick answer for the question, though. Can a non-singer become a singer? I think all of us are singers in some sense, but to become a stage singer or sing in public, there are certain qualities which are required. And that can be cultivated definitely. But there should be a basic inclination for that. Okay?
Inclination, as well as some kind of talent also.
Yeah. So that is important for us to cultivate or build upon. And that self-motive and liking will make a change.
Great. We'll ask the orchestra conductor, Garry, about this question. Garry, can the so-called non-singers can be converted into singers? Can you change the voice? What is your experience?
I will say that everyone do have their own talent. So talents given by God. So I will say that everyone have the talents to able to develop their voice. But to be a stage singer, it requires more additional talent as well, whereby they're able to perform, they can be trained, and also they needs to be cultivated. Because even though you can be singing like a bird, really good, but if you do not practice, you will find yourself or your vocal will not be as natural or even open up like a good bird who are able to sing very loudly. So in short, I think everyone's do have talents. Even we train with the disabled children, we can teach them to sing. But in order for them to sing like in a choir and also for as a stage singer, it needs certain criteria in able for them to develop to be a stage performer. So it requires a lot of hard works as well. So not just talent.
Great, thank you. One Priyadarshini, she's saying that enough of talking. Can the guests, or the panelists sing? So can you share the video? Are you able to share the video now, Garry? That YouTube video of your orchestra. Can you try once again?
Garry, just go to the basic
Okay.
screenshot in the
Let me
basic.
try again.
Yeah, just share the screen. On the top left, you can find one tick box, share sound. Just make sure it is ticked.
Share song.
At the bottom left.
Yep.
Just check it and then play the, and choose the, yeah, you're already chosen.
Can you see?
Yeah, I'm able to see, but not able to hear.
Oh. Okay, let me try again.
You need to maybe increase the volume of your laptop.
Okay, it's full. Audio setting. So let's try again. Okay. Can you hear anything?
Yeah.
That's fantastic, Garry. So it gives so much happiness to see the full 30 or 40 piece orchestra on the stage with an opera singer. So thanks for sharing, Garry.
Thank
you. Really gives us goosebumps to see. And I guess we have had an interaction, very nice interaction for the last almost 90 minutes have gone by without noticing even it. So thank you so much for being with us on behalf of Sri Ramchandra University. I personally thank on behalf of our director, Dr. Armugam sir, and on behalf of our Vice Chancellor, on behalf of the IASM, and on behalf of all the participants, I thank Garry, Dr. Prakash, Mr. Raj, and the participants. And this can be viewed anytime when you want because it's recorded. It will be there on the YouTube channel. You can feel free to share this link. So a lot of points to carry on today. I think we'll have some more programs like this and also some collaborative research between our universities and the interdepartmental among our university departments. And I think we have got a long way to go. So with that, with all your permission, can we close up the meeting for the day?
Yes.
Yes.
Thank you so much for this opportunity.
Thank you, Raj.
Thank you. Thank you.
Thank you, Dr. Prakash.
Thank you, everyone. Thank you.
Thank you, Vaishnavi. It was wonderful.
Thank you all so much. Yeah, thank you for joining us.
Okay.